Hello, this is Dr. Do again. This video continuously from previous videos streaming on the systemic approach of medicine. I talk about at different level from invisible of organic compounds and associated diseases, and then talk about the cell structures and functions of cells and associated diseases. Those are the invisible structures. And then move on to the tissues and move on to the organ systems. I'm on the talk about the respiratory system associated diseases. Last time I talked about the chest pain, which are associated with the respiratory system because chest pain can cause either by the lung or by the heart or affected structures or by the chest wall pain, like musculoskeletal pain. So I talk about chest pain that is caused by the major or commonly respiratory problems. Today I'm going to talk about another presentation, shortness breath or difficulty breathing associated with the respiratory diseases. Actually, this shortness breath or difficulty breathing, usually majority of cases are caused by the lung problem, even though the heart disease can cause this, leading to this shortness breath or difficulty breathing. However, the cause of shortness breath or difficulty breathing by the heart problem or cardiovascular problem probably eventually end up with the lung as impaired function, or cannot, for example, the pulmonary edema from the heart failure. So this is about, even though the respiratory system is not the primary system of diseases, but usually the shortness breath involved in the lung or respiratory tract. There's another condition can cause shortness breath, for example, anemia, which is not associated with the lung diseases and not associated with the heart diseases, but because of the hypoxia is another cause for the shortness breath or difficulty breathing. So this is about but I'm going to focus today on the shortness of breath or difficulty breathing caused by the respiratory system diseases. It's not difficult to understand. For example, in the children, the common cause, in addition to the infection called the bronchiolitis, for example, or pneumonia, or foreign body aspiration for the children, is another cause, cannot be ignored, because it even though maybe it's not common, but it could occur. Actually, as a matter of fact, probably more common than we think. Sometimes we just busy life and just the infant curiosity just accidentally aspirate some toys or some small pieces or food chunks or something like that. So that's the emergency situation. Regardless what the maneuver, you can do it, but in the infant or children, probably the sooner the better, call a professional, and at the same time try this maneuver to try to get that aspiration out. And also for different ages, the pneumonia or the bronchiolitis in children is also quite common, can cause this shortness of breath, because this inflammation may trigger the constriction of the trachea or bronchi, so that's definitely can cause difficulty breathing or shortness of breath. So this is another cause in children. Probably that's the major common cause. Of course, the genetic cause of heart disease or anemia can cause this, but I'm focusing on the respiratory system. So for adult, shortness of breath or difficulty breathing, again, I cannot exclude the pneumonia. The pneumonia itself, if it's peripheral on one area, localized, probably cannot cause difficulty breathing. However, if it is the interstitial, or it is the diffuse, or it is in the trachea, causing the trachea restriction, constriction, so that's another cause for shortness breath, difficulty breathing from the pneumonia. The most common one, notorious, is COPD. That's one of the most common cause of difficulty breathing in adult. I already talked about the COPD previously. Chronic obstructive pulmonary diseases, asthma is one of the risk factors, and chronic bronchitis, and also emphysema. So these are the common cause of difficulty breathing associated with respiratory system. In addition to this, and in terms of the management for asthma, usually asthma usually occur in the younger than middle age, probably young people. The overreactive reactive of the immune system causes this asthma. Of course, I think I just mentioned previously on the other video. And for the COPD, bronchitis is just the previous history of infections and not quite treated well, becomes a chronic process, and the body just produce a huge amount of mucus and cause this inflammation, localized inflammation, or diffuse, and then constrict the trachea. And also the end stage of this is the other condition is emphysema, which means the alveoli lost the normal functions, cause this expanded lung and cause this difficult breathing. And so on top of the COPD or asthma, there's another scenario, another cause of shortness of breathing is the interstitial lung disease actually causes shortness breathing at the early stage, because this interstitial conditions, just the structures between the function units, alveoli, those respiratory membranes which are responsible for the exchange of gas. And because of inflammation, this membranous structure for gas exchange was just thickened, so impaired gas exchange. So that, and also because of this fibrosis, inflammation limited the lung normal volume. So that is another common cause of shortness of breath, difficult breathing. However, it really depends on the severity and the causes. Sometimes the interstitial lung disease probably at early stage is symptomatic, but usually if it is caused by the silicon, for example, can have this difficult breathing, shortness of breath. So this is about another cause of the shortness of breath, or difficulty breathing. In terms of upper respiratory tract infection, it's so common. Of course, on the list of this difficulty, shortness of breath, or difficulty breathing is another cause. It depends. Sometimes because of the inflammation, even though it's viral caused nasal congestion, but probably the difficulty breathing, if it is in the upper respiratory system, is not that prominent. But if it's going down to the deeper, at the terminal of the bronchi, like a bronchioles, so that's the one I just mentioned, usually for the children at the beginning of this video. I just heard somebody's at the door knocking, so I just distracted a little bit. But anyway, so this is about the difficulty breathing associated with respiratory disease is quite obvious. Usually, in general, pretty much all the lung diseases can be associated with this difficulty breathing or shortness of breath. I just extracted some of typical, common, or serious conditions as an example to explain here. So I'm going to stop here, and I hope you can watch it, and hope it helps. And thank you for watching. I'll see you next time.